The Affordable Care Act goes into effect on January 1st. Here's what you need to know to get started on enrolling. In 2010, President Obama signed the Affordable Care Act, which was a piece of reform designed to greatly expand healthcare access. On October 1st, you'll be able to actually enroll yourself and your family in a plan on HealthCare.gov, which is a new open marketplace that boils down the super complex healthcare market to almost an Expedia-like engine for finding plans that fit your needs and budget, whether you're uninsured or interested in finding a better, more affordable option. On the main site, you can already get a feel for how the marketplace works. Answer a few basic questions about yourself, gender, age, state you live in, current insurance status, and you can be directed to your state's marketplace. There you can request assistance and calculate your approximate insurance costs for 2014. Again, here you'll find a simple set of questions about your household, and you'll see what plans you qualify for, at what cost, and if you're eligible for any assistance, all in an approachable layout. So joining us to discuss this project is Bryan Sivak, Chief Technology Officer and Entrepreneur in Residence at the Department of Health and Human Services. All right, Bryan, so thank you so much for talking to us. Now, the health insurance market is notorious for being both very confusing and also prohibitively costly, in particular for young people like a lot of our viewers who are just starting out and perhaps don't get it through their employer. Can you talk a little bit about how HealthCare.gov addresses both of those core problems?
Sure. So basically, one of the things that we've really focused on with HealthCare.gov first, primarily, is the idea of it being a true e-commerce website, as opposed to sort of your grandfather's, or, well, actually, that probably doesn't make sense here, slightly older brother's government website. We've been really focused quite extensively on doing things like focus groups, talking to end users, going to different demographics of people, engaging design firms, and a lot of this work has been happening over the last couple of years to try to make the overall flow of the site and the information that's presented to the user be as clear and concise as possible. So that's on the design side, that's kind of where we have come out. On the cost side, that's really the purpose of creating a health insurance marketplace. The idea is that we have built a transparent marketplace where people can look at health plans on an apples-to-apples basis and make intelligent decisions in ways that they've never been able to make before. And we're already starting to see that with some of the rates that have come in from various states, that the costs are actually a lot lower than what people typically have paid in the past.
Yeah. So in terms of building the site, obviously this is a huge scale project. And I read that it's open source. Why was it so important that this be open source?
Well, we're big fans of open source in general. And if you think about what we're trying to do here, there's the idea of communicating information around healthcare and health insurance is a pretty complex subject. And sometimes when you have people who are experts writing things for people who are not experts, you tend to get a little lost in some details. Or, if you're the government, you tend to use language that might be less friendly than, say, if your friend wrote it. And so what we're trying to do is allow people out there in the world to basically look at both the code and the content and make suggestions for things that might be more explanatory than what we've actually come up with. And we've had some really interesting results so far. A lot of people have actually submitted what's called a pull request on GitHub to actually suggest different changes to content, to code that we've actually put out there, many of which have actually been incorporated back into the site itself.
Interesting. So you mentioned that this is kind of a starting out point. Is there anything new that we can expect in 2014?
All kinds of crazy stuff. I mean, one of the things that I kind of have been pointing out to people for a long time now is that I think it's important to consider that these initial launches as almost like beta launches, right? I mean, we're putting something out for the first time, and we're going to be getting a ton of feedback and user information as we see how people are actually interacting with the various workflows that exist in the site, where they're getting hung up, places that might be causing questions. Keep in mind that the site has sort of live chat built in throughout the whole thing. Mm-hmm. So we're going to get a lot of really good data as people go through it about all of the different issues and areas that we could potentially improve the user experience. And so we're going to be taking all of that data and folding that back into the site to sort of make improvements over time. One important point to consider here is that This is a long-term process, right? Open enrollment is open for 6 months, the first year. Coverage begins January 1st, which is the really important date in this whole thing, because that's the date that people are actually going to have access to affordable healthcare coverage. But then once open enrollment closes in March, at the end of March, there's going to be a few months, and then we're going to open it up again. And that process is going to happen for years and years and years. So we have a long time to really work on making this as good of a user experience as possible. And so over the course of those years, all kinds of things are going to be developed based on this user feedback that will help people get through the process.
All right. And in terms of big picture, what would you define as sort of the long-term goals of the site?
Well, the long-term goal actually, I think, is pretty singular and pretty simple. The long-term goal is to provide as many Americans as possible with affordable access to high-quality healthcare. And so everything that we do is really focused on that one main goal.
All right, awesome. Well, very interesting, and it'll be really cool to see how this plays out. So thank you so much for giving us the insight.
Oh, my pleasure. Thank you.
Again, you can take a look for yourself at HealthCare.gov. Open enrollment begins on October 1st, and the plans go into effect on January 1st. Have you used the site? And if so, what are your impressions? As always, let us know in the comments. For TFN, this is Annie.